Welcome back, my friends. Today we're gonna talk about the abdominal aorta and its branches. We're gonna start with the branches which supply the GIT tract. The the arteries which supply the GIT tract it come from anterior portion of the abdominal aorta. We're gonna start with the celiac artery. It's for the foregut. It supplies the lower esophagus, stomach, and first part of the duodenum, and the second part, just the first half of second part of duodenum. Superior mesenteric artery, it supplies the midgut. Midgut is just from the second part of duodenum till the transverse colon. So it supplies the second part of duodenum, third part of duodenum, the rest of duodenum, jejunum, ileum, and ascending colon till the 2/3 of transverse colon. The inferior mesenteric artery is supplied the rest of GIT tract from the distal 1/3 of the transverse colon till the anal canal, but we have an area between the superior rectal area. It takes a supply from the circulatory portions. So let's see. It's just a single artery supply the GIT tract. Just single artery comes from anterior portion here. Just single one. Not like if we have a two artery in both sides, it's not for a GIT, it's for other thing else. For example, the first one up here is for phrenic artery for the diaphragm and the suprarenal arteries also. Here we have a middle suprarenal artery. We have two arteries directed to the suprarenal gland or adrenal gland. We have two arteries on both sides for the renal gland. Also we have two for gonadal artery, and down there till the bifurcation of abdominal aorta at level L4. So artery supply GIT structure is single and branched anteriorly here. Okay, so artery supply the non-GIT structure paired and branched laterally and posterior. Two area of colon. We're gonna speak a lot about the colon blood supply. Two area have a blood supply because the colon at the junction of midgut and the hindgut. We have it in the splenic flexure and the other junction between the superior rectal artery, as I said here. Okay, we have a splenic flexure. Splenic flexure with the flexure in the junction between the blood supply of superior and inferior mesenteric artery, as said, and it's just near the proximal 2/3 of transverse colon. So we have a junction here. It have a two blood supply. We call it watershed area. Its area susceptible to colonic ischemia. And the other area is rectosigmoid junction, is the last sigmoid artery branch and the last sigmoid arterial branch from the inferior mesenteric artery and superior rectal artery, as said. We have two syndrome added in 2020, I think, 2020 edition for first aid. Nutcracker syndrome and superior mesenteric artery syndrome. It's not a difficult one, so easy. So we're gonna talk about it right now. Okay, blood supply as well. Okay, the nutcracker syndrome is compression of the left renal artery between the superior mesenteric artery and aorta. The superior mesenteric artery is originated from the abdominal aorta at level L1 and go out here. And the renal artery for the left side here, it just sometimes the superior mesenteric artery give a compression. It's normal, it doesn't give any compression, but in genetically defect or in children, there is a course of superior mesenteric artery just near the renal artery and compress it on between the superior mesenteric artery and the abdominal aorta, that make abdominal pain from flank and gross hematuria because the rupture of the thin wall of renal vascular varicositis. Okay, so just decrease the blood supply for the renal, it make it congested, and decrease blood flow for the renal. That's it. Superior mesenteric artery, there is a loss of fat. As I mentioned before, the superior mesenteric artery is just below the pancreas here. Let's imagine this is the pancreas, and it originates here, and it have a fat just below it to make it a little bit far from the abdominal aorta when it originated from here. Okay, so sometimes the mesenteric fat diminished, so it is make it a little bit closer to the abdominal aorta on its course, which makes compression on it. So characterized by intermittent intestinal obstruction symptom because decrease of blood flow here, and primary postprandial pain because when it is normally without eating, the blood supply is enough for supplying the duodenum or the other part of GIT which is supplied by the superior mesenteric artery. But when you eat, you make a lot of bowel movements and need more blood supply to absorb the nutrients. So they're gonna feel like angina, abdominal angina, because it's a little bit stenosis of superior mesenteric artery because losing the mesenteric fat. So it's also compressed on the third part of the duodenum. Also, third part of the duodenum just have a course below the superior mesenteric artery. So it's compressed on the duodenum, typically associated with the condition diminished mesenteric artery, low body weight, or malnutrition. Oh, it's happened in malnutrition also because they decrease the fat in the body, so they make it it's happened to the malnourished children or elderly because it's compressed on the duodenum. That is for the abdominal aorta branches. Next here about the fat, it's a nice image. You know, see when we lose this fat here, we're gonna make the superior mesenteric artery compress on the duodenum, which have a course just below on the posteriorly to the superior mesenteric artery.